Welcome to Dental Diagnosis. If you look at the case, seems like a pretty normal scenario. It's an 80-year-old female with very modern dentistry. She's got a couple of implants. They are old implants. She's got old root canals. They are still in good condition. And the one thing that catches the elderly, if I look at this set of teeth, this was done by myself many years ago. It's more than 30 years old, the case. And the one thing that constantly catches the elderly is root decay. More and more over time, because patients are not keeping their teeth significantly clean all the way to the root, we find that these patients develop root decay. And we need protection against that. And if I show you what a root decay looks like, this is a tooth that looks like a typical normal tooth. And for the uneducated, it looks like, if you can see my mouth, that there's nothing wrong. But if you look carefully in that area, and I'm going to enlarge it, and it moves down here, you can see that there's a hole in that tooth, all the way right down the inside of the tooth that has started below the filling, all the way up there. And this is something that a patient would typically lose a tooth like this, or we would have to root canal it. And in an 80-year-old patient with low mobility, that is difficult to treat. Often these things end up in extractions, and patients that had a healthy dentition end up losing teeth. Most of these patients are also on drugs to prevent osteoporosis, which makes an extraction difficult, which makes a placement of a new implant difficult, and these patients end up in palliative care. We're basically trying to maintain what they've got. So don't let it catch you. Keep on keeping those teeth clean. Even if you become immobile, use an electric brush, use a fluoride toothpaste, make sure you floss, because nobody wants to be in a scenario where it's difficult to get to the dentist, and we as dentists have to perform procedures that are traumatic on frail or elderly patients. So be careful out there and make sure that you floss and you clean properly so that you don't end up with decay in your roots.